Good morning. The lessons that I have learned during the general pharmacology class would be first, of course, how drugs work and what it does to our body. I have learned the different mechanisms of drugs, their routes, how they work, and what they do inside our bodies. I have learned the four processes, which are the absorption, distribution, metabolism, and excretion. So I have also learned the different factors that affect drug absorption. So they are the first pass mechanism, the routes of administration, pH, solubility of preparation, dose and dosage. And I have also learned the factors that affects drug distribution, such as the blood flow to the desired site of the drug. And I have also learned that there are different types of drugs, namely the free form or the bound and the unbound. And the unbound one or the bound one is the one that fails to reach the site of action until it is excreted. And I have also learned that drugs can be excreted either by renal or by bile. And another lesson would be the lesson for the receptors, because at first I thought drugs would just work like magic. I never really thought that this would be this complex, that they have the lock and key mechanism, that the receptors would accept the message from the drug and would take it to their site of action. I have also learned that there are different types of receptors, like the the type 1 to 4 receptors. So the type 1 would be coupled by an ion-gated channel. The type 2 would be coupled with G protein. The type 3 would be coupled by an enzyme. And the type 4 would be coupled by DNA. And that the first three types are located in the cell membrane, while the fourth type or the type 4 is located in the nucleus or in the cytoplasm. I have also learned the different types of drug receptor binding, such as the bonds, the different types of bonds like the covalent bonds, the van der Waal bond, the ionic bonds, hydrophilic bonds, and hydrogen bonds. And what I remember the most is that the covalent bonds would be the strongest type of bond, while the van der Waals bond is a type of bond that there's not really much of a trigger for it. It just needs two types of cells that are close together, and that would trigger the bond. For the ionic bond, it would be triggered or bonded with electrostatic energy. And I also learned about the antagonist and agonist, that agonists activates receptors to produce or to have the desired response, while antagonist prevents that from happening, just like a main character and an antagonist. And I also learned about the um, complementary and alternative medicine, or CAM, that it's like the opposite of how we know medicine, that these are the types of management that can be offered to people who needs it, but like refuses to try the mainstream healthcare. This is like their alternative for their condition that would provide a much holistic approach to what they are feeling. Well, the alternative medicine is like explain like that, like you would rather try a holistic approach to your condition rather than the traditional or the mainstream healthcare offered by today's hospitals. While the complementary is like the ones that would boost the treatment plan that you're undergoing. These are like supplements or vitamins or a healthy diet that would provide a more support to what type of treatment you are undergoing. Yeah, so I have learned about massage therapy and how that helps people with that need like physical therapies, stress management, resilience training, meditation, and acupuncture. So, as you may have noticed, these alternative or complementary medications are like a little bit far from what the mainstream healthcare offers. So, this would be like something to enhance the treatment plan a certain patient is undergoing. It could help strengthen their minds, not only their bodies, because in mainstream healthcare, it's like the main focus would be providing the body with nutrients. It's like prioritizing the health of the patient with their bodies only. But with alternative medicine, it's like your mind with your body is going to be healthy. During the practice of stress management with meditation, it strengthens your mind, especially with the resilience training. It enhances your core values that you need to be strong, and it's nice that we have to learn that also. And I also learned about some medicinal plants. Personally, my father is a fan of herbal medicine. He loves taking supplements like moringa capsules, spirulina capsules. So I am a bit familiar with how these work, especially when he is at home. He always prepares like ginger with garlic and honey teas, and he gives us that tea when we have colds. That's why I don't tell him if I don't feel well, because he will give me that tea. I don't want I don't want to taste that tea. But sometimes when he notices, he gives me that tea he brews himself, and I have no choice but to drink it. It tastes it tastes not that bad. It's sweet, but it's like spicy because of the ginger. But I don't know. It's a bit spicy for me and it hurts my throat. But I still drink it because he prepared it for me and I don't want it to go to waste. Anyways, it's fun learning more about those medicinal plants and how they work, especially the ones that I am not familiar about, because as I've mentioned, my father is a fan of those, so I have learned some of them, but there are still many more out there that I am not aware about. So yeah, it's really it really helped me gain my knowledge more about that, and I think those type of herbal medicines really work. I don't know it's just like a placebo effect for me. But when I drink the tea that my father brewed for me, I don't, the next day I feel better. Especially when Doc Bungay mentioned that garlic is believed to be an alternative for like antibiotics. That amazed me. Like, garlic is an alternative for antibiotics. But I know that this type of alternative medicines will still have many studies to be approved. But yeah, this is still improving, and many people will eventually learn on this type of medicines. So, one herbal medicine that I have personally used, like continuously, was the, I don't think this is counted, but the guava leaves, the ones that you boil and you take a bath with it when it's warm. Because before, when I was a kid, I've got bulutong, and my mom always, parang every day I would take a bath with like warm boiled guava leaves. And another one thing that's familiar for me is the lagundi for cough, like cough medicine. But the lagundi I know is like the bottled ones, not the leaf itself. Like, what I'm familiar about is the ones in the bottle that's prepared for you to just drink. Yeah. And what else? Another would be ampalaya, or the bitter gourd. I never thought that the bitter gourd would be an alternative for managing diabetes, because I thought it was just a vegetable that's bitter. Same as garlic though. I never thought garlic would be like a alternative medicine for cholesterol. Yeah, that's like shocking for me. And what else is there? Yeah, I basically learned how drugs work, how mainstream drugs work, the drugs that are in tablets, capsules, and liquid formulas, how they work when we ingest them, how they go out of the body, how they distribute around the body, what are the factors that affects on how they absorb inside the body. And not just the drugs that are in capsules and tablets, I also learned about alternative medicines that are like plants and activities and trainings, and more on the spiritual and mental health. And yeah, that's pretty much it. And for Doc Bungay, firstly, I would say that it's nice being your student again for or else first, I think first or second year was the last. Parang there's one sem that you are not our instructor, 1 or 2 semesters, but it's nice to have you around again, because I really learned a lot from you, because you explain things really well and really a deep dive into those topics. And for improvements, I think I can say nothing about improvements, because I am satisfied on how our classes go. But if there is one, I think that would be more face face-to-face classes because it's really fun having you around me. It's really fun having you around though. And I think learning would be more like I would gather more learning when it is fun, when it is filled with fun. Yeah, I think that's pretty much it. And yeah, nothing more. I wish you Merry Christmas and Happy New Year.